To reduce the rate of hospital-acquired infections, it is important for healthcare workers to know the basic concepts of disease transmission. This model provides an understanding of how the chain of infection works and key IPC strategies to break it using COVID-19 as a case study. At the end of this model, you should be able to describe the chain of infection for COVID-19, identify key links in the chain of infection for COVID-19, and describe key IPC strategies to break the chain of infection for COVID-19. Infectious diseases result from the interaction of an infectious agent, susceptible host, and the environment. Transmission of infectious disease occurs when an infectious agent leaves its reservoir through a portal of exit, is conveyed by some mode of transmission, and enters through an appropriate portal of entry to infect a susceptible host. This process is called the chain of infection. The chain of infection refers to the series of events that has to occur to enable an infectious agent to cause infections in a person. In order to break the spread or transmission of infectious diseases, it is important to know the 6 links on the chain of infection. They include an infectious agent, a reservoir, the portal of exit, the mode of transmission, the portal of entry, and a susceptible host. Infectious agents include bacteria, viruses, fungi, or parasites with an ability to cause infection. A reservoir refers to a person, animal, or environment where an infectious agent can survive and multiply. The portal of exit is the means through which an infectious agent leaves the reservoir to a susceptible host. The mode of transmission is the mechanism an infectious agent uses to move to a host and survive in the environment. The portal of entry is the means through which an infectious agent enters a susceptible host, and a susceptible host refers to a person, animal, or insect capable of being infected by an agent. Infectious agents are disease microorganisms or pathogens that cause an infection or disease. They include bacteria, fungi, viruses, or parasites. The infectious agent in the 2019-2020 COVID-19 disease outbreak is a type of human coronavirus known as the SARS-CoV-2. A reservoir refers to a place where infectious agents can survive and multiply before infecting a new or susceptible host. This could be a person, animal, or the environment. For example, an infected person or beds and equipment in a patient's ward. Humans and animals which serve as reservoirs for infectious agents are known as infected hosts, while items or equipment that are not properly cleaned and disinfected are known as fomites. The primary reservoir for SARS-CoV-2 are bats, but it was transmitted to humans through an unidentified intermediary animal. Potential reservoirs for SARS-CoV-2 in a healthcare facility include infected patients or contaminated surfaces. A portal of exit refers to the means through which the infectious agent escapes from the reservoir. The portal of exit can vary from one infection to another. Portals of exit in animate reservoirs include the secretions or excretions from the skin, respiratory tract, or gastrointestinal tract. The main portal of exit for the SARS-CoV-2 is the respiratory tract via droplets from the nose and mouth when sneezing or coughing. However, hands can also serve as a portal of exit if a person touches a contaminated surface with his or her hands. A portal of entry refers to the means through which an infectious agent enters a new or susceptible host. For transmission to occur, the infectious agent will have to enter into the new host through a specific part of the body before it can cause a disease. Skin cuts on the skin or mucous membranes, respiratory tract, gastrointestinal tract, or insect bites could serve as a portal of entry. Most times, infectious agents use the same portal that was used to exit an infected host to enter a new host. For example, the respiratory tract serves as both a portal of exit and a portal of entry for the SARS-CoV-2. A susceptible person can become infected by inhaling respiratory droplets from infected persons. A person can also become infected with the SARS-CoV-2 when he or she touches a contaminated surface or object with his or her hands, and then touches their eyes, nose, or mouth. A person who develops a disease after exposure to an infectious agent is a susceptible host. Once the infectious agent enters a new host, it multiplies and often causes a disease. However, it is important to note that not all infected persons will fall ill or become symptomatic. Susceptibility to an infectious agent is based on the following risk factors: poor hygiene practices, underlying medical conditions, low immunity level or nutritional status, poor control of reservoirs of infection in the environment. Older adults and persons of any age with serious underlying medical conditions might be at higher risk for severe illness from COVID-19. The 5 main modes of transmission of an infectious agent from its reservoir to a susceptible host include contact transmission, droplet transmission, airborne transmission, vehicle-borne transmission, and vector-borne transmission. For this model, we will focus on the contact, droplet, and airborne modes of transmission, as these are the possible modes of transmission for SARS-CoV-2 and are critical to discussions around hospital-acquired infections. Contact transmission is the most common mode of transmission. It includes direct contact transmission and indirect contact transmission. Direct contact transmission occurs when an infectious agent is transmitted from an infected host to a susceptible host via direct physical contact. This could be through actions such as touching, kissing, and sexual intercourse, or through direct contact with body fluids or secretions from an infected host. For indirect contact transmission, there is no direct human-to-human contact involved. Indirect contact transmission occurs when an infectious agent is transmitted to a susceptible host via contact with fomites, such as medical equipment and tools in the health facility. Droplet transmission occurs when infectious agents are expelled from the respiratory tract through droplets produced by sneezing, coughing, or talking. These droplets are sprayed at a few feet in the air and then fall on the ground. Droplets usually contain infectious agents which can be deposited on the eyes, nose, or mouth of a susceptible host, especially when people are at close range to each other. The droplets can also contaminate an environment by landing on objects or surfaces such as doorknobs, where they remain infectious for hours or days. It is important to note that droplet transmission is not the same as airborne transmission, because droplets do not remain suspended in the air. Airborne transmission occurs when infectious agents are carried by aerosols suspended in the air and then inhaled by a susceptible host. The aerosols contain droplet nuclei, which are infectious particles of less than 5 micrometer in diameter, and remain in the air for a long period of time. They can also be spread to others over distances greater than 1 meter. This mostly occurs during aerosol-generating procedures such as tracheal intubation. Now that we understand the contact, droplet, and airborne mode of transmission, how is COVID-19 transmitted? COVID-19 is primarily transmitted through respiratory droplets and contact routes. Droplet transmission occurs by inhaling droplets from infectious persons, while contact transmission can occur by direct contact with contaminated respiratory secretions of infected people or by indirect contact with contaminated surfaces or objects in the environment. Airborne transmission of COVID-19 may be possible in certain settings, such as during aerosol-generating procedures, for example, intubation, manual ventilation before intubation, and disconnecting a patient from a ventilator. The basic reproduction number, otherwise known as R0, refers to the expected number of cases directly generated by one case in a population where all individuals are susceptible to infection. The table here shows the R0 for well-known infectious diseases. High values indicate that the disease is easily transmitted, while lower values indicate that the disease is not easily transmitted. Initial data indicated that the R0 for COVID-19 could be between 2 to 3. However, a recent study from the CDC, which studied data from China, suggests that the R0 for COVID-19 is around 5.7. This means that the R0 for COVID-19 may be higher than that of SARS. However, as this is an emerging disease, more data is still being collected from various geographic regions to understand and gain an accurate R0. Most hospital-acquired infections and community-based infections are colonizations and not diseases. To control hospital-acquired infections, the chain of infection needs to be broken. The IPC strategies for breaking the chain of infection for most infectious diseases include source control by removing the reservoir or microorganisms. This may include isolation and treatment of infected patients or implementing proper waste management procedures. Interrupting the mode of transmission by hand washing, cleaning with disinfectants, sterilization of equipment, respiratory hygiene, and proper donning or doffing of PPE. And finally, protecting susceptible hosts through social distancing, prophylaxis, vaccination, and wearing PPE. IPC strategies to break the chain of infection for COVID-19 and limit transmission in a healthcare setting include the following. Ensure triage, early recognition, and source control. That is, the screen, isolate, and notify approach. Application of standard precautions for all patients at all times. Implementation of empiric additional precautions. Droplet and contact precautions should be implemented in the care of suspected and confirmed cases of COVID-19. Airborne precautions should be implemented during aerosol generating procedures. Implementation of administrative controls and use of environmental and engineering controls such as adequate spatial separation of patients, appropriate ventilation, and appropriate cleaning of the environment. All of these IPC strategies will be extensively discussed in this model. Before we move into the next sub-model, let's have a look at the chain of infection for COVID-19 in a healthcare facility and the possible ways a healthcare worker can break the chain of infection. Take a minute to study the diagram. The chain of infection can be broken between each link. The first link is the infectious agent. To eliminate the infectious agent, in this case the SARS-CoV-2, IPC precautions, policies, or measures need to be implemented. An example of this could be the proper cleaning, disinfection, and sterilization of surfaces, tools, and equipment in the health facility. Environmental sanitation practices such as the fumigation and disinfection of the health facility and its surroundings are also IPC measures that can be taken to kill the virus. The next link is the reservoir. If this is an infected patient, he or she may be the first link of infection in the health facility. Any suspected case should be immediately isolated using standard precautions and the relevant additional transmission-based precautions. The SARS-CoV-2 can survive on fomites and be infectious for several hours or days. Proper cleaning, disinfection, and sterilization of surfaces, tools, and equipment is also an effective way to break the chain at this link. As discussed earlier, The portal of exit for the SARS-CoV-2 is through respiratory droplets and the contaminated hands. Appropriate distance of at least 1 meter should be observed between patients in the waiting room and also when transporting patients to the isolated room or ward. Hand washing using the appropriate technique, ensuring that infected patients practice respiratory hygiene and cough etiquette, and the use of PPE like the face mask or the face shields are also effective IPC strategies to break the chain of infection at this link. The main modes of transmission for SARS-CoV-2 are through droplets, contact, or airborne transmission. Healthcare workers should ensure that the appropriate PPE based on the precaution to be applied is worn. Proper hand hygiene practices and the cleaning, disinfection, and sterilization of surfaces, tools, and equipment is an effective way to prevent transmission and break the chain of infection at this link. One of the portals of entry for SARS-CoV-2 is through the mucous membranes. Transmission of infection can occur when a susceptible host touches fomites with his or her hands and then uses the same hand to touch their eye, nose, or mouth. In this situation, proper hand hygiene practice is a key IPC strategy in breaking the chain of infection at this link. If a susceptible host comes in direct contact with a suspected or confirmed patient and within 14 days begins to show symptoms or respiratory illness, he or she becomes a suspected case and should be isolated immediately, tested, and then managed according to treatment and management guidelines for COVID-19. Please note that this is just an example and that there are various possible scenarios that could occur in real time. The important message here is to ensure that at all times the appropriate IPC measures are being implemented to prevent disease transmission. Ensure to always refer to the National IPC Guideline for dealing with a suspected case of COVID-19. The updated version will always be available on the NCDC website. It is important that all healthcare workers have access to this document and that all recommended measures are implemented. Here is a recap of what has been taught so far. The chain of infection refers to the series of events that has to occur to enable an infectious agent to cause infections in a person. The 6 links on the chain of infection include an infectious agent, a reservoir, a portal of exit, a mode of transmission, a portal of entry, and a susceptible host. The chain of infection needs to be broken to prevent disease transmission. The modes of transmission for COVID-19 include contact and droplet transmission and, in some cases, airborne transmission. Effective implementation of the recommended IPC strategies for COVID-19 will prevent hospital-acquired infections and break the chain of infection.